about 2.5 minutes past our starting time, so let's go ahead and start. Bonjour, bienvenue dans session Zoom Heart to Heart International Haiti. Good morning and welcome to Heart International Zoom session about Haiti. I'm Kim Carroll, the CEO of Heart to Heart, and all of you are joining us as people and organizations that have a passion for Haiti. Whether you've partnered with Heart to Heart, joined us on trips, volunteer trips to at the Maison and Pétionville, or if you've traveled to Haiti with other organizations and groups, we're all here this morning because of our appreciation and admiration and respect for the people of Haiti. Heart to Heart International's work in Haiti began in 2010 when on January 12th, a devastating earthquake rocked the country, especially in the area immediately around Port-au-Prince. Heart to Heart's work has changed since that initial response, but we never left. Today, Heart to Heart International Haiti continues to provide disaster response for their island, but not only in Haiti. They are also part of Heart to Heart International's Caribbean work. Our Haitian staff deployed to Puerto Rico following Hurricane Maria and stayed under the harshest of conditions for months. They also supported the work that Heart to Heart International did, deploying as a team in the Bahamas following Hurricane Dorian, where we still are continuing to support work there today. So now, to lead us through today's call, I'm very pleased to introduce you to Wes Comfort, who is Heart to Heart's Caribbean Response and Recovery Lead. Like many of you, I met Wes at the Port-au-Prince airport 5 years ago when he greeted me for my first trip as a volunteer to Haiti. So Wes, over to you.
Great. Thank you, Kim, and thanks everyone for joining. It's great to see so many familiar names that signed up for the session. I know I met several of you in Haiti, but for those of you who don't know me, my name is Wes Comfort. I began my time in Haiti in 2010 following the earthquake, but began working for Heart to Heart in 2013. I wanted to share with you all a brief history of where Heart to Heart Haiti has been since the earthquake, which is where many of you began your journeys with Heart to Heart International and Haiti. I then wanted to share with you a few of our most successful and current programs to bring everyone up to date with all that's going on in Haiti. Like many NGOs, the earthquake in January 2010 originally brought Heart to Haiti, and we immediately set up our clinic in downtown Port-au-Prince at the National Soccer Stadium. Over time, we installed clinics in the nearby neighborhood of Bel Air and out in Léogâne, the epicenter of the earthquake. We utilized hundreds of Heart to Heart medical volunteers, and this was a very traditional Heart to Heart International response. As time went on, we began to see that a traditional emergency medical response wouldn't be sufficient to address so many other urgent needs in the country, specifically outside of Port-au-Prince in the rural mountains of Southeast Haiti and in Pétionville. Heart to Heart International began forming a team of Haitian nationals alongside American expats and volunteers to begin moving our Haiti program mission from survivability to sustainability. Heart to Heart International and Heart to Heart Haiti set their mission around 4 specific pillars: healthcare, education, leadership development, and income generation. In regards of income generation, leadership development, and education, Heart to Heart Haiti began implementing a microfinance project called MUSO. This stands for Mutual Solidarity. We began to implement this project into the rural mountain communities just outside of Pétionville. We eventually moved these programs in the southeastern portion of Haiti as well. These MUSO groups were formed and they began saving their own money in order to loan out funds to one another. Since the creation of this program and these groups in 2015, there have been a total of more than 40 groups that have been created with over 1,500 total members that have loaned out and saved upwards of $250,000 US. Not only are the numbers impressive, and we look forward to continue spreading these programs to surrounding communities, but the stories that are shared by the members of these groups are incredible. 2 years ago, while in Pétionville with Cherie Reese and a small team from Resurrection, who you'll hear from later, we interviewed several women who had taken out multiple loans since joining their local MUSO group. The first lady that we spoke to said that she took out a loan primarily just to refinance an outstanding loan that she had with a local loan shark. At that time, she was being charged almost 40% interest. So she took out a loan from her local MUSO group at a 2% interest rate. She paid back the loan shark, was still able to grow her business, and then also paid back her loan to her MUSO group on time and in full. She claimed that the opportunity to borrow money at an affordable interest rate cured her of her high blood pressure and her anxiety that was brought on by her previous loan. Another merchant we spoke to shared with us that because of the growth in her business, she was able to afford a roof over her entire home rather than having to use tarps over a portion of it. She went on to share that she was able to pour concrete down into her home and was able. This is the first time that her and her family didn't have to live on a dirt floor. A third woman we spoke to talked about growing all of her businesses, and now she was able to afford education and schooling for all three of her children, one of which is currently in university in Port-au-Prince. Many of these businesses that these loans support are hardware shops and salons, bakeries, etc. One industry that's really starting to explode is people who are just purchasing produce from their local markets and taking that produce into the markets of Port-au-Prince and selling it at a 300 to 400% increase. This has not only been extremely lucrative for the person purchasing and transporting the produce, but it's been very lucrative for the merchants in the mountainside of markets as well. They're able to sell their own inventory with very little of it actually rotting or spoiling, and they're able to use their profits to buy nutritious foods for their families, to put their children in school, and also afford consistent health care. Today, Heart to Heart Haiti oversees and operates 10 clinics. We operate 4 clinics in the southeast, 1 clinic north of Port-au-Prince in a town called Cabaret, and 5 clinics in the mountains above Pétaguave. And these clinics are run by 3 Haitian medical teams that can treat upwards of 40 and 50 patients a day. Although we do see a wide range of medical conditions, and our doctors and nurses are often treating chronic conditions such as hypertension and diabetes, many of these patients will need to remain on their medications and under reliable medical care for the remainder of their lives. We know that starting and stopping prescriptions in these cases can have very serious health implications, meaning it's vital that our medical teams return consistently and as scheduled. Alongside these non-communicable diseases, our medical teams treat infections, mosquito and waterborne diseases, and trauma regularly. We do love when international medical volunteers are able to come alongside our Haitian medical teams and provide supplemental care. Although the political unrest over the last couple of years, alongside the current challenges of COVID-19, has put our volunteer service trips on hold for the time being. Although we haven't been able to bring in our volunteer teams because of COVID-19 and other challenges, our community healthcare workers have been able to continue to reach thousands, spreading awareness and providing vital education. Following the outbreak of COVID-19, we were able to hire 3 different sets of community health workers to go door to door in the southeast and in Pétaguave to encourage social distancing and reinforcing the importance of wearing facial coverings. These agents also help families create hand washing stations at their homes using items that they had laying around. Another team in Pétionville and Kinskoff, which is south of Port-au-Prince, our community healthcare workers worked in open air markets and spread the same messaging and education. These agents faced tough questions by the merchants, but were able to build relationships with them, and over time began to see more and more merchants wearing masks and practicing better hygiene. After several months of this program, the mayors in Pétionville and in Kinskoff asked this training be adapted and focused into their public schools, so our agents began sharing the same messages with students and teachers. These students not only applied what they learned at school, but they were able to take this information back to their families as well. It's a very similar model that we've used in years past, combating different cholera outbreaks in many communities. While all this is going on, we have an additional team working 3 hours north of Port-au-Prince in a community called Las Cahobas, and they're on a 15-month UNICEF grant that we're extremely proud of. And this program's aim is to end the practice of open defecation and to help families build their own latrines. Now I'd like to introduce Director Josue Andre, who's our mission director in Haiti. Josue has worked for Heart to Heart Haiti basically since the beginning, and has taught me a majority of what I know about Haiti today. Josue is responsible for overseeing and executing all of our programs mentioned above, and many programs that I did not get into. Director Josue.
Thank you, Mr. Comfort. Thank you, Mrs. Kim. And my name is Josue Andre. I'm the Director of Mission for Heart to Heart International in Haiti. It's a pleasure to have you all on the platform. So talking about why community development has worked in Haiti is because we don't create a border between project providers and project recipients. So we see the people that benefit of projects as part of the whole process to implement, but also the decision process. They are involved in that. So that's why we have created about 19 federation of sectors that we groups different leaders within the community representing different sectors to be part to be part of a platform that will decide and think about the development for the community. So the beneficiaries and also the leaders are involved in what we're doing. So the absence of this border has helped us to succeed the project that we're doing in Haiti, and also to get some good contribution from the communities because they see the need of the project, because they come with the projects and also do they prioritize the projects and also put their own local resources into the implementation of the project. So that's really one of the main reasons of our success because we have that governance structure within a community that is like a bridge, and on that bridge we build all that we are doing in the remote communities of Haiti. And talking about examples of some programs and how they impacted the lives of the people, as Mr. Comfort just said. So we are doing Project 1/2, leadership development, community development, and wealth creation. So working in the Southeast and Port-au-Prince, and Petit Guave and Cabaret and Las Caobas actually. So I've seen families and women communities having improved access to quality healthcare. So those people would need to work from 2 to 7 hours, to get some help from healthcare and other places, because the women communities in Petit Guave and the Southeast in Cabaret, so Bercy, they don't have access to quality healthcare providers. So we are the only one provider, and this place is operating. So we are the only one offering this opportunity to get treatment, a quality treatment. And we had a program in the open market, and I've seen people, because we conducted a survey, and we found out that most of the people that were serving did not go to see doctor for about 10 or 15 years. And some of them have been once to see a doctor for about 10 years or 15 years. And actually, while we had that clinic inside the market, so we're able to move the ratio from 1 visit per 10 or 15 years to 5 visits a year. So that this has been a great impact in terms of people demanding for healthcare, but also in terms of the MUSO, we have seen people improving their lives, being able to send their kids to schools. We have also seen the women being more standalone, more autonomous within women communities, and people are being able to purchase livestock and work on their homes, improve their homes, and doing a lot of things because they have access to economic opportunities. So these are big impacts that we see on the lives of the people. Actually, we have helped over 5,000 people to access healthcare regularly, and distributed over 2,000 hygiene kits to all communities, and we have helped over 1,000 families to build their own latrines, which is about 5,000 people benefiting access to improved sanitation. And actually, we are working with UNICEF in Las Caobas, so we are helping more than 10,000 individuals to access improved water and sanitation. And in terms of the COVID-19, so we have seen progress in terms of people understanding the risk and threat of the virus and open a market, and also in rural communities. We have been able to reach over 30,000 people in the rural communities of Petit Guave and the Southeast. In the open market, we have been able to assist over 6,000 vendors and over 2,000 students at the schools. So those people, they are more aware of the virus threats, but also they are more aware of the need to practice, to do the gesture barriers to stop the virus to to stop the virus, but also they are using natural medicines to improve their immune system. So they got the education, information, and also are practicing gesture barriers to face the virus. So these are some of the basic impacts that we are having on the lives of the people that we're serving in Haiti. Now we have the honor to introduce you Cheryl Reese, who is one of our long-term supporter. She's with the Church of Resurrection.
Thank you, Director Josue. So like Heart to Heart, Resurrection started going to Haiti after the earthquake. And after several years, we wanted to move more from relief, but to holistic community development. And for us, that entailed economic empowerment, education, faith, obviously we're a church, and health. And so Casey, my predecessor, Casey Stepp, met Steve Weber, and he had wanted to empower Haitians for sustainable community development. He was concerned originally that a church would not want to do that because the results would take years, not months or weeks or days, before we got any return on our investments. But regardless, after the conversation, we decided that community development was the way to go, and so we were in. So when we started working with Heart to Heart International Haiti, they began identifying local leaders to become staff, like Director Josue, who just spoke. And this staff started partnering with us in the community where we were already working with Methodists, which is the community of Pédagogue. And Director Josue and his team identified the local leaders from a variety of community sectors in Pédagogue, and he trained them up to become a federation. And so that's part of the education that we do, is in empowering the local leaders. And then they began the Economic Empowerment Project, the MUSO project that Wes was describing some of the success stories that came out of. We've also partnered together on reforestation projects following Hurricane Matthew, as well as a cholera response after a cholera outbreak, which obviously is health. And then most recently, partnering on those mobile medical clinics in the 5 rural communities in Pédagogue with the local Haitian health physicians. So Heart to Heart Haiti has identified and equipped the local Haitian leaders. And without their key role in this, it would have been really difficult for us being in Kansas City to figure out how to do that. So the partnership over the past decade or so has helped our congregation understand that outreach is more about equipping Indigenous leaders to discover their own community's challenges, as well as how to solve them, versus coming in with our own ideas and suggesting how they fix their challenges. Community development is a very hard concept to communicate. For instance, you can't see a child getting food, or often you can't see clean water given to community. But what you can see is local people standing with pride and dignity because they're leading their community through transformative change. So it's worth every minute trying to figure out how to tell that story. So we're just excited to be part of this conversation today, to be part of helping Heart to Heart Haiti International tell that story. So back to you, Wes.
Thank you, Cherie, and thanks everyone for participating in today's Zoom session. We're always thrilled to share updates about the progress we're making in Haiti. I would like to invite all of you to help me engage others to become part of this effort. We're looking for churches, nonprofits, and other groups to help support our efforts. If you could share information about this exciting news with your organizations that you're involved with, or connect me with the right people within your organizations, I'd be happy to present our latest outcomes and impact report stats. Again, thanks for being a part of Heart to Heart International's Haiti outreach. We look forward to many more years of continued success in the country. I'd like to take a minute or two here to see if we have any questions that came in during the presentation. I'll just wait just a few seconds.
So Wes, this is Kim.
Yeah, Kim.
So a couple that we can start, there's several coming in. I'm going to start with this one. It's a 2-part question. Can you tell us a little bit more quantifiably how you think COVID-19 is impacting Haiti, and what do you see, how do you see Haiti rebounding from that?
Sure. And I'll probably also be tapping into Director Josue here to help with this. Quantifiably, if you look at the numbers coming out of Haiti, it actually doesn't seem like COVID has been being spread and being as impactful as it has, for example, for the United States. Now we know that there are very few places to get tested in Haiti, and very few people would have the financial ability to be tested. So we certainly know that those numbers aren't necessarily accurate. That being said, we have been relatively impressed with just with how few numbers are actually reported, and then what we've been seeing out of the hospitals as far as people needing respirators and advanced life support. We are facing challenges with disinformation similar to what we're seeing in the United States as well. And so the community health workers being able to, one, build relationships into these communities and open air markets to continuously supply information has been very, very important. As even as just about a month ago or so, a government official in Haiti came out and had announced that COVID had been defeated in Haiti, and a lot of people took that to heart, which means that we're going to have to work a little bit more into reaffirming and reassuring people that COVID is still a thing, masks are still important. Obviously, many people in Haiti don't have the luxury to order and have things delivered to their house or to not go to work, and so having to work within the age of COVID with distancing, with proper sanitation, proper hygiene, with masks are going to be really important. Director Josue, if you're still with us, do you have any thoughts on COVID-19 and next year in Haiti?
So I thank you, Victor. I'll be sure. So regarding 2021, I'm seeing some people trying to get back the attention of the population on that, because as you know, the virus didn't strike the way we were thinking. So all we don't really have the information on how many cases that we really had in Haiti, because there has been some kind of fever. Many people got the fever, but no one has really been in the hospital. So the report we had was about 500 people, and now people are losing, track of the virus, because also the World Health Organization did congratulate Haiti about the natural medicines, and also the way that they hold the fever at home. But for 2021, so I can anticipate some bigger challenges, because the borders are open. So we have a lot of people coming in. So we don't really know if we're gonna get a second wave of the virus in 2021, and how will that look like. So I think it's still important to keep the education on COVID-19 and trying to keep the people aware of a second wave of the virus.
So Wes, a follow-up on that, you mentioned masks, and could you speak to some of the resources that Heart to Heart International has been able to ship down in terms of PPE and other resources?
Absolutely. So with our partners at Food for the Poor, actually, we were able to get quite a bit of PPE into country, which was vital. There is, generally speaking, just cloth face masks are very accessible, readily available, and affordable for people in Haiti. And so our agents were telling people, one, the importance of masks, how to make temporary masks themselves, and then also places that they could purchase masks in country. But getting people to wear masks was the biggest challenges. Regarding our community health agents and our medical teams, we didn't have, obviously, the luxury to stop our work, and so making sure that they were safe as they were going from community to community and continuing to spread awareness and treat patients was vital. And so luckily we were able to send in quite a bit of PPE early on, primarily N95s, other surgical masks, and then for the medical teams, proper PPE. I think there was a question regarding spreading PPE or being able to distribute, and for the most part, we didn't. We did a little bit of masks, but caring for the teams and then encouraging the population to either make their own masks or to be able to find local masks was key. And again, because it was so easy to find affordable masks, that's the route we took there.
Yeah, and that's great because it supports the local businesses down there, which, we never want to send aid in that then hurts the local economy, but we did.
Certainly.
Initially, there was actually a State Department block on distributing any PPE outside of the country because we had such shortages, but we were able to navigate through that and get enough down to our teams. But yeah, the textile industry is a really big industry in Haiti, and so we want to continue to support that.
Yeah, absolutely, Kim, and that's a great point. That certainly limited how much we could get to Haiti, was the State Department's mandate that not much PPE would leave the United States.
Yeah. So another question, and you may want to engage your colleagues, Director Josue and Cherie, because it's a great question, and there's no simple answer, but perhaps lots of answers. Are there other ways people in Kansas City or even outside of Kansas City can help? In addition, of course, to supporting us and other organizations that are working down there financially, as well as sharing information about these collaborations that we have with CORE and other organizations, to telling other churches or nonprofits. I would even suggest, if for those of you, I'll take my first answer, and then you guys can build better responses to that. But I wouldn't limit it to just telling other churches and nonprofits, although they do have a passion for Haiti. But I think, telling your friends, if you're talking to them on Zoom, if you're talking about international challenges, I think, for any of you that work in the for-profit world or have family members in the for-profit world, while right now, there's a lot of inward focus, and it's understandably so, given this is a global pandemic, and the challenges are tough. But I think sharing the highlights of what the good work that's happening there, and at least helping people know, because I think the more people know about Haiti, the more people want to support it. And certainly my worldview changed during the week I spent with Director Josue and actually Cherie and Wes there, and it opened my eyes. So, and I traveled a lot of the globe, but so I think just sharing that and then hopefully someday people will also want to make that trip when it's safe to do so again. So that's my contribution. But Wes, you, Cherie, Reese, please chime in.
Yeah, absolutely. Thanks, Kim. And please take down my email address. And if you're looking for more ways to get involved and are looking for more information, please reach out. I'd love to speak with you and your team or whoever else is interested about more details about what we have going on and all the programming and success stories we've had, but also to help find ways in the time of COVID and other some of the other challenges we face in Haiti, how to get your group or your team or your church or company involved. Cherie or Director Josue, do you have any follow-up or any other comments?
I would add that we talked about telling the story. I think it's important to also help people realize that when they think of Haiti, a lot of times they are thinking of disasters and relief initiatives. So I think, especially when you're talking with organizations that want to, for instance, like banks or credit unions or things like that, that are really interested into supporting the growth of economics globally, this is a great opportunity, the MUSO project, for them to get involved in, because it is equipping and empowering the local people to grow in their economics. And then we're also going to do what's called a virtual trip coming up in February that you all could join on. But basically, we'll have Director Josue and some of the Federation leaders kind of just sharing the story of what's happening there, showing video footage, interviewing people, and just really trying to get a better understanding of what's taking place there. So that might be a fun way to get involved and actually meet people as best as you can via Zoom until we can actually travel again.
So I will just be short, and as you know, so we don't really have a lot of good news, on Haiti circulating around the world, on the globe. So if you could help, putting the emphasis on the good things that you see happening on the national in Haiti, so that will be wonderful. So when you talk to people, please highlight, the positive things, the good things that we are doing, and share the news about, these changes that you're seeing happening in most remote communities. Thank you.
Absolutely. With us. It's a really great point, and Sheree, thank you as well.
Wes, question just came in. You might not have seen the acronym for MUSO and what that means. Could you speak to that, or you or Sheree?
Absolutely. So MUSO is MUSO, and it stands for Mutual Solidarity. We call it a microfinance program because that rings, at least that sounds familiar to most people. And to be fair, MUSO is significantly more than just microfinance. Not only are these groups saving money together and loaning out their own money to one another for business support, but they're also providing, they've set a portion of the proceeds aside from their work, specifically for an emergency response fund in their community. They set another portion aside that if a member of their community is ill or someone in their family faces a hard time, that they have, as a group, they have some money available to assist. They also have money set available that if someone in their group gets married or something very positive or exciting in their lives, that the group has some money to support that. So although they do give out loans and support the local businesses in their areas, they all are, the whole point of MUSO is to bring everyone together as a way to support everyone through the good times, through the bad times, to have a little bit set aside for the next time cholera comes through or the next storm that comes through. One of the impressive, incredible things about MUSO is how little it takes from an outside investment standpoint. So you'll see a lot of times with microfinance, what an NGO or a different group would do is they might take X amount of dollars from a donor, and they would use that money then to loan out to individuals. What MUSO does is says, okay, we're going to take the outside money, we're going to use that money for education, we're going to help train how to run businesses, how to run meetings, how to do a proper accounting. They're really going to spend a good amount of time, over 12 months, supporting that effort. As the community continues to save money together, they can continue to loan out their own money. So if money isn't being paid back, it's local money that's not being paid back. The other benefit of that is that the loans and the size of the loans and the number of loans can grow as groups mature. And so when they start out, maybe they're only giving 1 or 2 loans at a time. That's $10 or $20 until they can kind of create the kitty and get things going. And now in which they can provide loans. Basically, they can't provide enough loans. They have so much money saved and they're doing so well that they need more people in their communities, and they're looking for other corporations, other businesses locally to invest in to help reinforce it and build local infrastructure.
Thanks, Wes. Got another question. I know we're running a little bit long, but people are hanging in there and still asking questions, so that's wonderful news. How do we sign up for the virtual trip, Sheree?
So I have a link that I can send out to, would that just be best? Will you be sending a follow-up email? Because I can get it to you to send it out.
Yeah, so we will be sending up an email following this. This has been recorded as well, and so we'll send this out. So if there's anyone who's on the call or anyone who's not on the call who'd like to see the information, they can get it from the video. And then, yes, Sheree, we'll be sending another email out. We'd be happy to add the link to that.
Okay, perfect.
Okay, so I am going to wrap us up, and I would also welcome all of us, if you have any specific questions, we'll make sure you know how to reach us via email, and as mentioned, we will send out the recorded version of this. Feel free to share it with friends or on your social. And we just really want to sincerely thank all of you for your passion and commitment or interest about learning more about Haiti. And would very much like to thank all of you for being here. And Wes, Sheree, Director Josue, thank you for leading us through an interesting and informative discussion. So our best wishes to all of you to be safe, be well, take care of your families and your neighbors, your communities. We want to be like Haiti. So thank you very much.
Thanks again, everybody. This concludes today's session.